We learn about the ABG in very 5 simple steps. So how to interpret the ABG? First, we'll see the pH. The normal pH is 7.35 to 7.45. If pH is less than 7.35, it calls as the acidosis. When pH is more than 7.45, we call it as the alkalosis. Then we have to look for the PCO2. So PaCO₂ is the basically respiratory component. Normally is the 35 to 45. If it's more than 45, we call it as a respiratory acidosis. Less than 35, call it as a respiratory alkalosis. It means if PCO2 is high, it means our patient is hypoventilating. Is less, it means our patient is having hyperventilation. Then we have to remember rule ROM. ROM RO means respiratory move in the opposite direction. So wherever there is a respiratory problem, pH and PCO2 will move in opposite direction. Whenever we'll have the metabolic problem, pH and bicarbonate will move in the same direction. So we have to remember the ROM. Then next we have to check for the bicarbonate, means metabolic component. Normal value is 22 to 26. If its bicarbonate is less than 22, it's a metabolic acidosis, and if it's more than 26, it's called as the metabolic alkalosis. So bicarbonate basically reflects the kidney regulation. Next, we have to identify the primary disorder. So whether it's a primary disorder or additional disorder. So if pH is going less, PCO2 high, and bicarb is normal, it means if there is a respiratory acidosis. Causes could be the COPD, sedative overdose, and respiratory failure. If pH is more and PCO2 is less, bicarb is normal, means respiratory alkalosis. The causes will be the anxiety, pulmonary edema, and early sepsis. Then pH is decreased and PCO2 is normal and bicarb is also decreasing, means metabolic acidosis causes could be the sepsis, renal failure, and diabetic ketoacidosis. If pH is going up and bicarb is also going up, means metabolic alkalosis. Causes could be the vomiting, diuretics, and NG suction. So basically, the bicarbonate reflects the kidney regulation. Next, we interpret the respiratory acidosis. So is respiratory acidosis, check for the compensation. Kidney will increase the bicarbonate for the compensation. In alkalosis, kidney will decrease the bicarbonate for the respiratory compensation. Next, for the metabolic acidosis, pH will come down, patient will hyperventilate, and PCO2 will come down. In metabolic alkalosis, lung will hypoventilate and PCO2 will increase. So if pH becomes the normal, but PaCO2 and bicarb is abnormal, it means ABG is fully compensated. So we'll understand with the one simple example. If pH is 7.28 and PCO2 55 back on 24, it means here pH is less and PCO2 is going up. It means the pH less, it means acidosis and respiratory is going high. So it's a respiratory acidosis and bicarb is normal. So causes could be the acute respiratory acidosis. Thank you.